Hello, I'm Isaac. I'm a student nurse in Muskegon Community College. How are you doing today?
Good.
Good. All right. Looks like you're scheduled for a health history interview. Is that all right if we did that right now? Okay, it'll take like 20, 30 minutes. That's fine. Okay. Can I just get your name and date of birth, please?
Gwendolyn Croft, 9/21/2002.
And how old are you?
21.
And what's your height and weight?
5'6" and then 220 pounds.
Okay. And then is Gwendolyn alright? Gwen, Mr. Croft, what do you prefer?
Gwendolyn.
Okay. Perfect. And what brought you in today?
Just like general checkup.
General. Okay. Alright. Perfect. And do you have any more specific like health concerns at all?
Like frequent urination and not frequent enough bowel movements.
Okay. So you just have to pee a lot, you mean?
Yeah.
Okay. Okay, anything else?
No.
Alright. And then for current immunizations, do you have the influenza, pneumonia, or COVID shot?
I don't think I have any of them, no.
Okay, gotcha. And then, do you have any medication or food allergies you should be aware of?
Sulfa eye drops and like light onion allergy.
Okay. Sulfa eye drops, do you know what happens when you use those?
Itchy and inflamed and...
Okay.
I don't remember, it was when I was little.
Gotcha. It's been a while then.
Mm-hmm.
Alright. And then food allergy said onions.
Mm-hmm.
Okay. Anything else?
No, but like onion, like itchy throat and eyes and everything.
Okay. And that's always been like that for you?
No, I developed an allergy.
Okay. Alright, and then are there any current medications you take like regularly?
And like, yeah, I take desmopressin 0.2 milligram tablets as needed, and meclizine 12.5 milligram tablets as needed. And I don't take either of them a lot. And then I take a vitamin C supplement and a vitamin D supplement almost every day.
Okay. And have those been helpful for you?
I think
that
so.
you've noticed?
I don't really know, but yeah.
Alright. And then have you had any problems with your meds at all? Or had any questions on them?
No.
Okay. Alright. Do you drink any alcohol or use any other substances at all?
Yes, alcohol and like coffee.
Okay, alright. You just drink coffee? Or any other kind of like caffeine intake you get? Yeah.
Energy drinks sometimes. I guess like how much or just?
Yeah. How much caffeine would you say you drink a day?
Well, like 3 cups or like an energy drink, so like maybe like 200 milligrams or more, and then alcohol I drink like maybe once every 2 weeks. Not very much.
Okay. And that's just been for like the past year? For alcohol?
Yeah,
Okay.
I've drank caffeine for a long time though.
Okay. Alright. And then surgical history, you have any surgeries?
No, wisdom teeth removal, but
Wisdom,
no
okay.
other ones.
Gotcha. Have you had any recent falls?
No.
Okay. Alright. And then I'm just going to go through a couple conditions or family history. If you just let me know if your family has a history of it and what side it would be on. Any heart disease?
No.
Okay. Diabetes?
No. Yeah, type 1 on paternal, and then a little bit of type 2 on paternal as well,
okay.
on my dad's side.
Okay. High blood pressure?
No.
Alright. Respiratory disease?
No.
Okay. And then stroke?
Mm-mm.
Alright. And cancer?
Yeah, breast cancer on both sides, like both grandmas.
Okay. Alright, and then do you have any history of any breathing problems, such as like asthma, pneumonia, or any surgeries?
No.
Alright. And do you experience any shortness of breath that you've noticed?
No, just like after a run, but no,
Okay.
nothing major.
Right, nothing irregular. Alright, and then any coughing?
No.
Okay. Alright, and have you experienced any chest pain or any heart palpitations?
No.
Okay. And then have you had any dizziness?
A little bit. That's why I take meclizine as needed.
Gotcha. Alright. But you'd say that's pretty under control.
I think so.
Does it happen often?
No.
Alright, and then your exercise tolerance, would you say it's good, fair, or poor?
The middle one's like fair.
Fair, okay. Alright. And then, do you personally have any history of any like high blood pressure, heart disease, heart attacks, any heart issues at all?
No.
No? Okay. Alright, I don't know if you've heard of the USD and MyPlate.
Mm-hmm.
Alright, so just the diet, recommended intake every day. We're just gonna draw kind of what your MyPlate would be. I can go through each section if you want to just let me know kind of percentage wise or what you eat every day for those.
Okay.
So yeah, just through the entire day, breakfast, lunch, dinner.
Mm-hmm.
Do you eat every meal every day?
Yeah.
Do you skip any?
No, I don't skip any.
Okay, gotcha. For protein, how much would you say you eat every day?
That's probably a big part of my diet. I eat like bacon and eggs at breakfast and like some sort of sausage or meat at lunch and like probably chicken or beef at dinner.
Okay. Alright. And then any grains at all, really?
I like white rice sometimes, but not like I'll have crackers sometimes, but not
Okay.
like I don't eat toast or anything. Not a major part. I don't have sandwiches.
Okay. And do you have any dairy?
None.
None. Okay. And are you choosing not to eat dairy, or is it like a intolerance you have?
Just like lactose intolerance, so
Okay.
I just avoid it.
Alright, gotcha. And then fruits and vegetables, do you eat much of those?
Not very much. I'll eat like broccoli or something with dinner, but not very many.
Okay. So would you say your protein's probably like, what percentage would you give it?
Like maybe 70 or 80%. Like I have a little bit of everything except for dairy, but mostly like meats, I guess, and like fish.
Okay. And have you had any recent like weight gain or loss that you've significantly noticed?
No, it's just like consistently higher than I want.
Yeah. Okay. And satisfaction with your weight?
Not really.
No. Okay. And then any appetite changes that you've noticed recently?
None.
Okay. All right. And then your water intake per day, what would you say?
Like.
A gallon's like 128 ounces around.
Like not a whole gallon, so like maybe 100 ounces.
Okay. And then have you had any dental problems with your teeth? Any cracking, pain?
Nothing major, no.
Okay. Alrighty. And you had mentioned you came in kind of for the bowel movements a little bit. Have you had any difficulty eating at all? Just with like swallowing, any heartburn or pain?
No, like heartburn after a run sometimes, but nothing major, no.
Okay. And then any like nausea, vomiting from that?
No.
Okay. And when was your last bowel movement, would you say?
Like 6 days ago.
Okay.
That's like my regular.
It's usually every like 6 days, you'd say?
Yeah.
Or,
I don't go very often.
gotcha. And when you do the color consistency, would you say it's regular? Or?
I think it's like hard to pass.
Okay.
But like I think the color of it is fine.
Yeah, okay. Alrighty. Any other concerns with that there?
No.
No, okay. And then we'll go into, you had mentioned an issue with urination as well. We can cover that here quick. Have you had any problems or recent changes in pattern or incontinence?
Nothing recent. It's just always been consistently bad.
Okay.
Yes.
What would bad be?
Very frequent strong urges. I go like once an hour. I'll probably wake up like 2 or 3 times a night to go. Like I feel like I'll wet my pants like once a day or something.
Okay, gotcha. Alright. You said it's kind of your normal pattern you've had?
It like affects my life though.
Okay. And would you say it's more like incontinence or you just really have to use the bathroom a lot?
I think both.
Okay. All right, and when you do urinate, is there any pain or hesitancy at all?
No.
Burning at all? Okay. Have you ever had any UTIs or blood in your urine?
No.
Okay. Perfect. Any more questions on that?
None.
All right, and then have you had any recent hair loss, unexplained at all?
No.
And how would you describe the health of your nails? Would you say they're dry, healthy?
Sturdy. They grow
Sturdy.
normal.
Alright,
They're not dry.
perfect.
Cracking or anything.
Yeah. Alright. And then for your skin health, would you say it's dry, itchy, any sores anywhere?
No, it's mostly fine.
Okay. Have you noticed any like color changes at all or anything?
Not really.
No. Okay, perfect. Alright, and do you use sunscreen when you're out?
Not really.
No.
I cover
Not
my
at all.
skin a lot, but no.
Alright. Alright. And then are you currently experiencing any pain at all?
No.
Okay. Perfect. And sleep habits, how often or how many hours a night would you say you sleep?
Like that I am asleep or that I'm in bed?
That you would be asleep getting some rest.
Probably not more than like 5 hours. I'm like in bed longer than that, but I can't fall asleep.
Okay. So you'd say you have difficulty falling asleep?
Yeah.
Okay.
I feel like my mind is like racing at night, or like if I wake up to use the restroom and then I can't fall back asleep.
Would you say you have difficulty staying asleep once you are asleep?
I think so because I wake up a couple times a night.
Use the bathroom?
Yeah.
Okay, gotcha. Alright. And do you have any specific limitations with your mobility? Just like muscle, bone movements at all?
No.
No? Okay. No pain with any movements
No.
when you're exercising? Alright. And do you have any history, personally, of arthritis, backache, swelling of joints, any weakness at all?
Not really.
No? Okay. And do you wear any glasses or contacts?
None.
No? Okay. Alright, and when was your last eye exam? Do you know?
Last July. Not this July. Like July 2023.
Alright, and you have any vision changes since then at all that you've noticed?
No. I feel like my eyes get bothersome when I'm on my period, but not like
Gotcha.
vision changes.
Okay. You have any hearing aids or hearing loss at all?
Mm-mm.
Okay. Alright, and then have you noticed any changes in taste or smell?
No.
No. Okay. And what about sensations? Like any numbness in
No.
your limbs or anything? No. Okay. Alright, a couple more here. Any history of seizures?
Mm-mm.
No. Alright. And then any memory changes that you've noticed?
No.
No. Okay, perfect. Alrighty. Alright, moving in. Do you have any history of vaginal discharge, any sores, STIs, problems with menses, stuff like that?
Not really anything. I'm regular.
Okay, perfect. Right. And do you regularly do self breast exam?
Mhm.
Yeah. Okay. Any issues with that at all?
No.
And have you ever had, or when was your last pap smear?
I haven't had a pap smear.
Yeah. Okay. Alright. Is that something you'd be interested in learning more about today?
Yes.
Yeah,
I
okay.
would like to get one.
Gotcha. Alright, and then contraception?
No, I
No.
don't take
Okay.
anything hormonal.
Alright, moving down here. Who would you say your support system is? Or any like significant others you would rely on?
My family, my husband Isaac, my mom Andrea, my sister Alicia.
Okay. Alright, and do you feel safe in your environment?
Yes.
Yeah. Okay. What would you say your most important health goals are to you?
I think like strength and like fitness, like longevity, I guess.
And are you satisfied with your career currently?
Not really. Like I feel like I second guess myself a lot and change careers a lot, and
Okay.
just I don't know. I feel like I overthink it a lot. And
Yeah.
not like I don't enjoy what I do.
Oh, okay. Do you have any current stress, fears, concerns about like work, family, finance, and stuff like that?
I think so. I feel like I overthink a lot, and like I feel like I worry and have fears about the future, you know, and like also have concerns about like current things and just overthink like day to day things a lot.
Yeah. Okay. Alright, anything else for that?
No, just like I guess I get stressed easily about like money and finances and everything, so.
Okay, gotcha. Alright. And what's your usual method of coping with your if you have stress?
Cry a lot.
Alright.
I do like devotions and like time with God, and
Okay.
going to the beach probably does help.
Gotcha.
But yeah.
Anything else?
No.
Alright. And would you say that crying is pretty often, or?
It's multiple times a week, so yeah.
Alright. Alright. And do you have any history of depression, mood swings, anxiety that you know of?
I've not like been diagnosed with anything. I have mood swings, but
Okay.
yeah.
And what would you say your greatest personal strength is?
I don't know.
Not sure. I never liked that question either. Alright. So going on to kind of about your healthcare here. What beliefs would impact your healthcare at this time? So just like, what would you like as in alternative therapies, supplements, stuff like that?
I don't want to be on a bunch of medications. I would be
Okay.
okay with like therapy or something.
Gotcha.
And like I know medications are important, but I don't want to be on a bunch of stuff.
So try everything before the meds.
Mm-hmm.
Alright. And what's your ethnic cultural background?
American, white, culturally.
Alright. Over what areas of your healthcare do you feel you have control?
I don't know. I feel like I'm not where I want to be at. Like I feel like I can't control my weight even when I try, or like I decide what I eat, but I feel like it's not great, and I'm able to like work out, but I feel like I can't do it as much as I'd like to, or as efficiently as I can.
Okay. But everything else about your house you're pretty okay with at the moment?
Yeah, no,
Taken
like
care of.
I guess like no major concerns.
And who do you need close by when you're sick?
My mom, my husband, my cat.
Cat person. Alright, and then is there anything else that we haven't talked about at all?
No.
Alright. Covered. Alright, let's summarize this here quick and then you'll be all set.
Thank you.
Alright, yeah. Your name's Gwendolyn Croft. Age 21, height 5'6", weight 220. Sound right?
Mm-hmm.
You just came in for a general assessment. You had a couple concerns about your bowel and urinary. Anything else to add at all?
Like concerns or to the list?
Yeah, like just anything that we didn't cover at all.
Oh no, I feel like we covered everything.
Okay, perfect. Well, you're all set. It was nice to meet you. The doctor will be in just a moment.
Thank you.
Yeah.